Jordan River Anderson. The First Nations Child and Family Caring Society of Canada describes Jordan as a medically fragile child who spent 2 years unnecessarily in the hospital because the Canadian provincial and federal governments could not decide who would pay for Jordan's services when he went home. The dispute ended because Jordan passed away in the hospital waiting for a decision. The only reason Jordan did not go home when he was medically stable was because he was First Nation, and the government did not want to set a precedent for paying for an Indigenous child to receive services. Any other child would have gone home without incident, but for Jordan, this was not a reality.
Jordan's principle is a legal rule named in memory of a very special little boy named Jordan River Anderson. Jordan's principle makes sure that when a child needs services, they get them right away. This applies to all services, including healthcare, education, and child welfare, and to all First Nations children on or off reserve.
Jordan's principle says, every child, no matter who they are or where they live, should get the services they need to grow up healthy and proud. There are many children where Jordan's principle can help. If your child or someone you know needs services, there's help.
To refer a Jordan's principle case or to get more information, call the number or visit the website.
Jordan's principle came to fruition in 2007 as a result of what happened to Jordan. The federal government of Canada passed Jordan's principle to ensure that Indigenous children were able to receive the same access to services that all other Canadian children would receive. Chambers and Burnett reiterate this law means that the level of government who has the first contact with the child will be the one responsible to pay for services, and that any dispute should be handled after the service has been paid for. The ongoing problem is that the federal and provincial governments are not implementing this law and have begun to change the rules about what cases are applicable to Jordan's principle.
Well, what we've seen immediately after that was the government trying to narrow Jordan's principle to only apply to children with disabilities, with complex medical needs and multiple service providers. Jordan's principle applies to all government services. And what we also saw is that First Nations were being left out of the conversations about how best to implement Jordan's principle. They became conversations really between government officials at the federal and provincial level. So, sadly, I was hearing reports by family members, healthcare workers, social workers, community members across the country saying, I have a child who's in a Jordan's principle situation, who's being denied services they would otherwise receive because they're a First Nations child. And yet the government's official statements are that there's been no Jordan's principle cases since 2008.
Cindy Blackstock discusses the dire need for moral courage within child welfare systems in Canada. She points out the inequities in child welfare that focus more on following policy and procedure than allowing for innovative practices to occur. There's a heavy focus on compliance within children's services, and sometimes this compliance comes at the cost of safety to children. Allowing Indigenous children to continue being refused funds for services is one of the costs of being complacent. Cindy Blackstock recognized this and decided to do something about it. Acknowledging Jordan River Anderson as one of her mentors, she filed a human rights complaint in 2007 that led to the creation of the Human Rights Tribunal. Blackstock is holding the Canadian government accountable to upholding discriminatory laws and practices that deny Indigenous children rights that other Canadian children would have. She accounts for her moral courage as a key player in her pursuit of equitable treatment for these children. In the context of child welfare, Czech and Wellborn discussed the United Nations Convention on the Rights of the Child, UNCER for short. Article 2 of this convention emphasizes non-discrimination, and that every child has the right to be treated fairly, regardless of where they live, gender, ability, race, socioeconomic status, or any other factor. UNCER was signed by Canada in 1990, and Jordan's principle falls within this framework. Furthermore, Czech discusses structural approaches in child welfare social work, a framework that emphasizes the impact of systems and structures upon a child, and how that child in turn may influence larger systems. These structures are intersectional in nature and take into account race, culture, socioeconomic status, and ability, among others. As Jordan was heavily marginalized by these factors, being an Indigenous child with high medical needs, his death had a massive impact on child welfare practice in Canada and elicited changes to federal policy. With that said, there is ongoing debate regarding the extent to which Jordan's principle is being honored in child welfare systems. King elaborates on the lack of implementation of Jordan's principle in Canada with respect to Indigenous children from a larger political perspective. King argues that neoliberal policies and rhetoric, in combination with harmful stereotypes, perpetuate the marginalization of Indigenous peoples. An oppressed group fighting for sovereignty and unique rights that do not align with neoliberal perspectives ultimately results in the needs and rights of Indigenous children left being unfulfilled. This macro perspective has implications for social work practice in child welfare. Wellborn emphasizes the importance of understanding interlocking oppressions from both micro and macro perspectives, and utilizing self-reflection as a tool to minimize the power differential that exists inherently in child welfare social work.